Okay, so it's the 7th of July, Sunday, and it's 2:30 in the afternoon. So this is day 5 beyond the day of my surgery. So it's the last day that I take my antibiotics, the last day I put the ointment on the wound. Second last day of anti-inflammatory steroids. Yeah, so kind of coming to the end of the recovery treatment anyway. I would say that there's a lot more. Well, I'd say the swelling is maybe comparable to the way it was yesterday. Still wearing the bandage around my head at night to sort of try and compress it and get the swelling down as much as I can, but it doesn't really seem to be doing very much. And actually wearing the bandage itself is a little bit uncomfortable and a little bit painful. I've got a lot more tightness. I can feel, I don't know where the sutures were placed, but sort of you can feel these lines down here of tension. I don't know if that's the muscles. They feel very tight, and all kind of underneath the jaw and the neck. It's just very achy, and any kind of movement is just, you can kind of just feel it getting compressed. It's a bit achy and stingy. So yeah, very uncomfortable. I'd say, yeah, definitely the worst the swelling's been, although only marginally worse than yesterday. In terms of pain, again, like if I don't move, then it's okay, but I think the pain it's probably the most tender, like the most sensitive to movement, etc. So yeah, a little bit annoying. But actually the bruising, strangely, I don't know if it's the lighting or I don't know, but yesterday I had sort of these yellow lines going down here and down here, which were pretty obvious. But honestly, today I'll just check the mirror. Yeah, I mean today they're much less visible. So I don't know if it's just, I don't know. Maybe it's hidden by the swelling or something. But yeah, it seems to have gone away pretty much overnight. So that's a relief, because that was kind of my biggest concern about going back to work, potentially tomorrow, Monday, is the bruising. The swelling I'm not too bothered with. I mean, like I said before, it's kind of, you can kind of see it is swollen, but it's not swollen to the point where I think this is running low on battery. It's not swollen to the point where it's like ridiculous. It's just kind of a bit more than usual. So maybe people notice, maybe they'll think that something looks a bit off, but I don't think it's going to be enough to make me sort of really worried about going back to work. And if the bruising seems to have gone down, substantially from yesterday to the point where it's basically not visible, then I would hope that tomorrow it's going to be completely invisible. So yeah, I'm pretty relieved and sort of tentatively confident that I'll be able to return to work tomorrow without anyone noticing that I've had surgery. But we'll see. Not really sure what more there is to say, really. So yeah, I'm just looking forward a lot to seeing Dr. De Silva again on Tuesday. Just kind of haven't really been in contact at all. He said I could contact him whenever, but I haven't really felt the need. But yeah, I am just kind of wanting to. Just a little bit worried, I guess, and just wanting to make sure that everything is still in place and going fine and there's no infection or anything, just to put my mind at ease. But there's no reason for me to believe that anything is amiss, so I haven't really contacted him for that reason. I am hoping he'll allow me to shave once the stitches are removed, but I think the guidance said not for 2 weeks, so that is a bit annoying. Presumably I can shave bits of my actual face, just not the neck. So I don't know, maybe I'll be able to tidy it up a little bit. But yeah, I don't really like being unshaven. I feel very sort of dishevelled. Yeah, I don't think there's really any further updates. And yeah, I'll check in tomorrow and let you know whether I actually went to work or not.